Welcome to the Deep Dive. Today we're looking at something quite common that can worry parents: sudden hip pain in young kids.
That's right. We're using some revision notes focused on transient synovitis.
And our mission, as always, is to pull out the key info you need, quickly and clearly. So let's start with the basics. What is transient synovitis?
Okay, so it's basically a temporary inflammation of the hip joint.
Temporary, okay.
Yeah, exactly. It causes acute, sudden hip pain. You see it most often in children aged, say, 3 to 8 years old.
Right.
Though the range can be a bit wider, maybe 2 to 12. And sometimes people call it irritable hip.
Irritable hip, got it.
Yeah.
And what actually causes this inflammation?
Well, the precise cause isn't fully understood, actually.
Oh, really?
Yeah, but there's a very strong association with recent viral infections.
Like a cold or something?
Exactly, like a common cold or a bit of a bug the child might have just recovered from. It seems like the body's immune response to the virus might be involved.
Interesting. So are there particular risk factors? Who's more likely to, get this?
The main group is definitely kids age 3 to 10. That recent viral illness is probably the biggest indicator we see.
Okay.
There might be a slight family history link, maybe, and it does seem to be a bit more common in boys than girls.
Right. And what's happening inside the hip joint itself, pathophysiology-wise?
It's essentially inflammation of the synovial lining. That's the tissue that lines and lubricates the joint.
Okay, the synovium.
Precisely. That inflammation leads to pain and makes it harder or more painful to move the hip. And again, it's likely tied to that post-viral immune reaction.
Now, this is important. What else could cause similar symptoms? What are the serious things we need to be aware of? The differentials.
Yes, this is absolutely crucial. The number one thing to rule out, the most serious differential, is septic arthritis.
That's a bacterial infection in the joint, right?
Exactly. It's a medical emergency. Needs very prompt treatment.
So how would you tell the difference, potentially?
Well, with septic arthritis, the child is usually much sicker. Think high fever, severe pain. Often they absolutely refuse to move the leg or bear any weight at all.
Okay, big red flags there. Anything else?
Yeah. Other possibilities include things like Perthes disease, which affects blood supply to the hip, or sometimes even a hip fracture, though less common. Osteomyelitis, reactive arthritis. There are a few others.
But septic arthritis is the main one to exclude urgently.
Without a doubt.
And how common is transient synovitis overall?
It's actually described as a really common cause of hip pain in this age group. While exact UK numbers are tricky, clinically, it's seen quite often.
So what are the telltale signs for parents or caregivers? What should they look for?
The main thing is that sudden onset of hip pain. Often it presents as a limp.
Right, they just start limping.
Yeah, or they might complain of pain or just refuse to walk or put weight on that leg. You might notice some mild stiffness. A low-grade fever is possible.
But not usually a high fever.
Correct. A high fever would make you much more concerned about septic arthritis. The pain is typically felt in the hip or maybe the groin area, and often there's that history of a recent illness.
So maybe a little memory tip?
Yeah.
Limping kid, maybe cold before?
That's a good one, yeah. Captures the key features.
Okay. So if a child presents like this, what kind of investigations might a doctor do?
They'll often start with blood tests, looking for signs of infection or inflammation like white blood cell count, CRP, ESR.
To help differentiate from septic arthritis.
Primarily, yes. Sometimes, if there's real concern about infection, they might perform a hip joint aspiration.
Taking fluid out of the joint.
Yes, to analyze the fluid directly for bacteria. Imaging is also common, usually an X-ray first, often to rule out things like fractures or Perthes, though it might be normal in transient synovitis. Ultrasound can be useful too. It can sometimes show fluid in the joint, an effusion.
And how is it managed? What's the treatment?
The main focus is really on pain relief and rest.
Simple things first.
Exactly. Over-the-counter pain medication like paracetamol or ibuprofen, NSAIDs like ibuprofen can help with the inflammation too. And then limiting activity, encouraging the child to rest the hip until the pain settles.
How long does that usually take?
It generally resolves on its own, usually within a few days, up to maybe a week or two. Occasionally a bit longer, but mostly quite quick.
And the prognosis, the long-term outlook.
It's excellent. Really good. The vast majority of children recover completely with absolutely no lasting problems.
That's reassuring.
It is. Symptoms are typically gone within a few weeks at most.
Are there any potential complications, even if they're rare?
Complications are very uncommon with transient synovitis itself. The main theoretical risk is missing an underlying septic arthritis if it wasn't properly ruled out initially.
Oh,
So if symptoms get worse instead of better, or if that high fever develops, that definitely needs urgent reassessment. But for straightforward transient synovitis, complications are rare.
okay, so summing up, transient synovitis, common cause of sudden hip pain or limp in young kids, often follows a virus, usually gets better quickly with rest and pain relief.
That's the gist of it, yeah.
But the key is being aware of those red flags, especially high fever, to make sure it's not something more serious like septic arthritis.
Absolutely. It really underscores how even seemingly minor childhood complaints sometimes need careful evaluation to rule out the serious stuff.
Definitely. Which makes you think, doesn't it? What other common, perhaps minor-seeming childhood symptoms might actually warrant a closer look sometimes?
Food for thought.
Indeed.
Yeah.
Well, for more resources and if you're preparing for the MSRA, do check out passthemsra.com and also freemsra.com.
Great resources there.
Thanks for joining us for this deep dive.